for this 6 days, the newly increased discharged have been exceeding the new death cases. Recently, we have pulled on all resources to improve our prevention treatment, and we have conducted this categorized treatment on the 5th, according to the instruction of the leading working group. We have given instruction to treat all those that needs to be treated, and admit those who have to be admitted. If anyone underperform, and we will give relevant policies to correction policies to compel them to do so. We have conducted telephones of all the confirmed cases to make sure that they have been hospitalized. As of February the 5th, we have set up 651 quarantine places with more than 23,000 wards, 1,600 doctors, 2,500 nurses, 334 vehicles for transfer, and secondly, we are speeding up the process of nucleic acid test. The CDC, together with 83 test professionals, also come to our aid. And we have finished the testing of more than 12,000, among which 6,500 are in Wuhan. Altogether, we have processed in a provincial level more than 89,000. We also continue to expand medical supplies. We have identified 136 hospitals, providing 29,000 beds. 28 of these hospitals are in Wuhan, and more than 5,000 beds are provided. On the 23rd, Huoshenshan Hospital is put into use, and Huoshenshan will also be put into use very soon. We also have mobilized medical resources and human resources of all aspects. As of the February the 5th, altogether, we have more than 10,000 medical workers from all over the country come to our assistance. In Wuhan City, we have 96 medical teams with more than 9,000 medical staff come to our assistance. We also have sent 11 medical teams to help the other cities in our province. We also try our best to implement the instruction given in the 5th edition of treatment plan, optimize the process, especially to the critical cases, and pull the best human resources together and conduct a collective treatment of the severe cases. The treatment of critical cases are our top priority, and we have also introduced several designated hospitals, including the Union Hospital and other 3 hospitals as designated maximum institutions to admit critical and severe cases. And we also have forms of academicians to do rounds and tours of the patients of the severe cases that are admitted. We also have organized medical team professionals to the other cities, to instruct the treatment. 6, we attach great importance to the treatment of special groups of people. For example, for the pregnant women who are identified as suspected cases and children, we also have assigned 90 hospitals, respectively, to streamline the process for treating these special groups of people. Coming up, we'll continue to act upon the instructions of General Secretary Xi Jinping's remarks and continue to improve the hospitalized rate as well as recovery rate and reduce death rate and morbidity rate. Now, floor is open to questions. Please identify yourself before asking the question. With Renmin Daily, the central government have made it clear that 2,000 more professionals will come into your aid. So how do you allocate and deploy these human resources to the best of their use? We have received assistance from all over the country. The Central Party Committee have sent the best medical resources our way. As of February the 5th, the NHC, the Chinese Medicine Administrative Bureau, and other 27 provinces, cities, and military hospital have sent our way more than 12,000 medical professionals our way, and to that we are deeply grateful for the help of the Chinese people as well as our government. In order to scientifically mobilize the medical resources, we coordinate our work based on the following aspects. It has to be reasonable, well, high efficient. First of all, we need to coordinate the need, the demand of the treatment, as well as the local medical supplies. We have to allocate these teams in a way that they are sent to the places where they're most needed. Wuhan is the city with the most cases and the most severe cases. So we have allocated the lion's share of the medical squads into our team. That is about 96 teams and more than 9,000 medical workers are allocated to Wuhan, including two teams from the PLA. We also pay our attention to the scarcity of medical supplies in other cities outside Wuhan. We have altogether sent 11 teams of more than 1,000 medical professionals to Xiangyang, Xiaogan, Huanggang, Suizhou, and Jingmen, so on. This is for our teams to cover as much population as possible. So we basically keep the formation of the original medical teams so that they can work in accordance with each other. Besides, based on different demand of medical resources, we also have done some adjustment to the structure of the teams so as to reach a better balance in terms of supply and demand. Besides, we also have strengthened the coordination between the local medical professionals and the external aides, and so as to create a better environment for our medical teams. These are precious medical resources sent our way from the central government, so we have to use them wisely and efficiently. With the CMG and CCTV, currently, is there an understaffed problem in Hubei in the medical front? First, I can answer it definitely that yes, we are still suffering from understaffed in terms of medical workers. Since the outbreak, our medical workers are standing at the front line, and right now for over 30 days, many frontline workers did not get enough sleep or rest. They have to work overnight, multiple shifts, some of them are working consistently, and many of them are suffering from fatigue. Right now, we are at a critical stage, so we still have a gap in terms of supply of medical workers. Right now, 9 cities have asked the leading group to allocate more human resources their way, and the gap is about 2,200, which I think is a very conservative number, especially in some departments, for example, respiratory and CCM, critical care medicine, ICU. We are severely understaffed. To address this problem, on the one hand, we are trying to usher the potential of the local medical resources, so better coordination and modulation at the local level. We also encourage domestic institutions to hire back the retirees with a strong physical condition to cope with the challenges ahead of us. Also, we have sent request to the central leading group, to special leading group, to continue to send medical helps our way. I think the understaffed situation is somewhat related to the undersupply of medical resources. If the protection measures are not in place, we cannot open more hospital wards, which in turn would deteriorate the understaffed situation. Currently, protective suits, N95, and protection goggles are still in tight balance and short supply, and this to some extent have deteriorated this gap of medical human resources. With Legal Daily, is there a gap in terms of nucleic test kits? And is there a problem to screen all of the suspected cases with the diagnostic kits in hand? Thank you. Currently, we have our stock is around to 109,000, and right now all of the diagnostic institutions can meet the demand of the nucleic acid test, but we are still lacking in certain terms of human resources and protective gears. We will be conducting procurement and participate in modulation and training of the sampling personnel, and so as to reduce the effect of our testing work to the minimum. With CMG, many Wuhan residents have asked for help through social network saying that the beds are not enough to take in all of the patients. So is this problem addressed effectively? And what kind of measures have you taken to address this problem? And what are the measures to treat these critical and severe cases?
谢谢这位记者朋友的提问。针对武汉市一床难求的这么一些问题
It's no secret that we are having a short supply in terms of hospital beds, so we have taken multiple measures to increase the supply in this regard in order to address the undersupply problem. Generally speaking, our province are working in coordinates to solve this problem. Here are some of the measures. First is to set up the collective quarantine spot to ease the pressure at designated hospitals. The leading group have issued the guidance on the categorized screening and treatment of the patients, as well as the collective quarantine spot. So this is a very comprehensive. This involves a very comprehensive screening of the population, especially the fever patient. For those who are showing pneumonic symptoms, they are sent to collective quarantine location for isolation. This is for the confirmed cases with light syndrome. During this time, if their situation deteriorates, they would be transferred to designated hospitals for treatment. For the suspected cases that are admitted in the hospital, if their nucleic acid test shows negative and the pneumonic symptoms are gone, they will be sent to a collective location for further quarantine and being discharged after a second negative in the nucleic acid test. These measures, to some extent, can ease the pressure of hospitalization in designated hospitals. And second, we also have been require more resources, human resources and medical supplies in order to keep these hospitals running. We also would ask that the city government can increase the number of designated hospitals and publicize those information as soon as they can. So the leading group also ask that we establish this accountability system, register all of these patients, and guide them to the designated hospitals. And those who disobey the requirement will be published based on the law on prevention of infectious diseases. You also asked about the treatment of severe and critical cases. We actually ask that the city organize designated locations to treat the severe and critical cases. Tongji Hospital, Renmin Hospital, and the Western Hospital of the Union Hospital. So the opening up of these 4 designated hospitals have, to a large extent, eased the pressure of treating these critical and severe cases. So the leading group, the commanding center, have also organized a inspection team led by experts. And altogether, there are 8 teams of experts to do rounds of the hospitals in our province. We also conduct online guidance this kind of long-distance guidance to the medical institutions. And we also have central leading team led by Huoshenshan and Wang Chen and other academicians to strengthen the inspection and guidance of key areas. This is of paramount importance to us in terms of prevention treatment. We're also exploring treatment methods that combine CCM and Western medicine so as to improve recovery rate and reduce mortality rate.
你好，我是长江云的记者。武汉现在正在进行4类人员分类集中收治的和隔离的工作。
Wuhan is categorized the patient into 4 types. So is it possible to test all of the suspected cases and admit all of the confirmed cases? And is it possible to conduct effective quarantine of the suspected cases, as well as the close contacts for medical observation?
我市新冠肺炎疑似病例，包括
The suspected cases in our city include those who are kept in the fever clinic and those who are hospitalized in medical institutions, as well as those that are kept in the quarantine locations for observation, in order to ensure that they can receive nucleic acid test. We have a very strict regulation in terms of the process of transportation, sampling, and testing. And currently, we have altogether 35 institutions that can do this test and that can process this test, and making sure that the suspected cases on the day can be sampled and tested on the day. You also mentioned that is it possible to admit all of the confirmed patients? It is our requirement to admit all of the confirmed cases. Currently, for the severe and critical cases, they are admitted in the 68 designated hospitals. For the light syndrome patients, they are collectively admitted in the medical institutions. And for the quarantine of the close contacts and the suspected cases, we ask that the community send these fever patients to the community clinic to do a pre-screening. If they think that this patient needs to be further screened, they will be transferred to the fever clinics for further diagnosis and checkups. The doctors at the clinic will do a comprehensive testing of the patient, including epidemiology tests, pulmonary chest, and radiology checks. And after that, the doctor will will determine whether this qualifies as a suspected cases. If the suspected cases shows very severe syndrome, this person will be sent to a designated hospital. If it's a mid syndrome or light syndrome, part of the patient will be kept at the fever clinic for observation, and part of them will be sent to the quarantine location for suspected cases, where medical staff are also assigned. We will also be making sure to do very strict disinfection of the quarantine location. And if the suspected cases finally turn into confirmed cases, the people with close contact will also be quarantined in specific designated locations. Right now, we are mobilizing protective gears and are mobilizing human resources at the grass level and community level to participate actively in this prevention control at the grassroots level. With Economic Daily, my question is, there are patients complaining that it's still not easy to get their samples tested in time. So, were there any updates? Are there any updates? Second, we still see a sharp increase in terms of confirmed cases. So, what are your comments on that? To expedite the testing procedure is crucial to the treatment of the confirmed patient, but also can help us to control the source of infection. I've heard a lot of complaint about the difficulty of testing. In order to address this problem, we have done the following measures. At a provincial level, we have expanded the number of nucleic acid test institutions. Altogether, there are 97 institutions, including 66 hospitals and 18 CDCs and 13 third-party institutions. If they're running in full capacity on a daily basis, they can process more than 10,000 test kits. The third parties are expanding their capacity as we speak. Besides, we also have conducted training of processing these test kits so as to make our work process more smoothly. We also ask that the institutions run in full capacity, build a reporting system of the test results. And third, we also have strengthened supervision, organized panel of experts to do inspection in all cities. And for those places with the biggest problems and challenges ahead of them, we will provide them with the much-needed assistance of medical resources and technical support. We have a daily report system in Wuhan for those institutions who cannot do the test independently. We will do this kind of contracted testing processing of these kits and strengthen the work in this regard. Altogether, 210,000 kits were sent our way, and for those understocked places, we will do modulation of these supplies in a timely manner in order to ensure the sufficient supply. So in the past 3 days, the number of test kits exceeds 10,000 on a daily basis. As of February the 5th, altogether we have processed more than 80,000 kits. Of course, we are also challenged by other constraining factors.
还有组织
For example, the shortage of personnel
我们下一步呢，
and
尽快
the lacking of lacking of diagnostic kits.
在检测工作方
In
面
the future, we will do better work in this regard to better meet the demands.
疑似病人确诊的速度啊，也相应的加快。大家也都看到
With the improvement of testing capacity, we see a sharp rise in terms of confirmed cases,
不断的增长，这个呢，与检测工作加快啊是有一定的关系。
which has a lot to do with the speeding up of the processing of the test kits.
新冠肺炎主要通过呼吸道飞沫传播和接触传播。
The disease is mainly spread through droplets and contact. So what kind of personal protection advice would you give to those who stay at home?
感谢记者朋友的提问。新冠肺炎的主要传播途径是呼吸道飞沫传播。
The coronavirus pneumonia is mainly transferred through droplets and physical contacts. During this epidemic, it is important for our residents to protect themselves. However, recently, we've taken notice that we still need to strengthen the following aspects. First is to strengthen the ventilation, wear masks to crowded places.
一次性口罩不适宜重复或者长时间的一个佩戴。
Disposable masks not suitable to be used for multiple times. Exchange them every 4 hours. And avoid unnecessary travels outside, especially to crowded places and public places. And avoid gathering and collective activities, and keep your distance with others, at least 1 meter. And second, when you are coughing or sneezing, please cover your nose with a tissue. And after going back from the outside or after you have contact with pets or animals, make sure that you wash your hands. For towels and utensils and plates and bowls, you need to have individual set of the cooking and eating utensils. Also, strengthen physical exercise in order to improve immunity, and do not believe in rumors and do not spread them unintentionally. If you have a family member or friend who is suffering from fever or suffering from respiratory syndromes, you have to inform the community and persuade them to wear masks and go to medical institutions. Last but not least, clear your daily garbages, especially the garbages like tissues or masks. They must be stored in dustbin with lids.
好，记者的提问今天就到这里。下面呢，再请
That's all
发布
for
人
from the
回答
questions
两
from
个
reporters.
网友比较关
Now
心的
two
问
more
题。
questions from
第一个问题，
online viewers.
有消息称，武汉的汉口
First,
北批发城业主愿意捐
the
9万件控制的
wholesale
商铺做病
one of the
这个是
wholesale
真的吗？
owner in the
相关部门是否已经开始考察？
Wuhan city
这个
is
问题
ready to
我们来请
make
张红
ready
军
to
先生
transfer the wholesale market into a quarantine center. Is this
在
rumor
汉口
true?
汉口北商铺业主愿意捐献几万件商
We
铺
heard
作为病房的消
that
息。根据实地管理
the
的
business owner of this wholesale market
到实地进行了考察调研，
is willing to donate to transfer their
确系，
warehouses, their
但是它仅有
shops into
整
temporary
个汉口北的
temporary
小商品市场
quarantine
整体出售
center.
率高达70%以上。那么其他闲置的商铺也是零星散在其中，所以它很难做一个独立的空间
these are scattered shops in a wholesale market, so it's difficult to use these locations as a centralized quarantine spot or location. But I still want to thank our residents for your strong support. That is a great boost of our confidence. Second question, sometimes we have to go out to purchase the grocery. So can you tell us more about the disinfection at home, especially after going out? So before you return home, you need to take off your mask, fold your mask, and restore them in a garbage bin with lids. Wash your hand and use alcohol with more than 75% of concentration to spray on the shopping bags. And second is to ensure ventilation at home. One in morning and one in afternoon, and at least 30 minutes of ventilation to let the fresh air in and reduce the risk of transmission. In a naturally ventilated place, and a not so well ventilated place, you can use the fans or other facility to help with the air exchanges. Before doing the disinfection at home, you need to wash your hand first, wear rubber gloves or disposable gloves and masks, and use the 8-4 disinfectant that is diluted 50% of one and one disinfectant and 100 shares of water. And first step is to boil the necessary towels and other utensils. In terms of the second step, is disinfection of doorknob and other surfaces in your home. You can use a paper towel or cloth towel to do the cleaning of the surfaces. Also, you can use disinfectant to clean the floor. And after 30 minutes, you can mop the floor again with clean water. So 30 minutes for the disinfectant to work before you use clean water to mop the floor again. For other cloths, such as your bedwears, your clothes, as well as your towels, you should use these sterilized detergent to do the washing. And last but not least, clean your cleaning tools, including your mops and swipes. And last but not least, take off your mask, toss them away in the lidded dustbin, and wash your hand. I want to thank all of our speakers and thank all of you for your questions. That's the end for today's press conference.